Hi, welcome to Nursing 423 here at Simmons. It's the second part of your pharmacology course, and I'll be your instructor. My name is Paul Williamson, and I've taught this course now several times. I started with Simmons back in July of last year, 2014. So welcome to the class. It's going to be a great class. You're going to learn a lot, and we're going to have a lot of good discussion, and this time will go by quickly. I know you're all very busy. Um, I have, just by way of introduction, I'm, of course, a registered nurse, have been for 14 years. Prior to that, I was a respiratory therapist. I got my master's degree in acute care nurse practitioner education at Vanderbilt University, located in Nashville, Tennessee. And then from there, I went on to get my PhD in nursing education. And along the way, I've taught in several institutions, the University of Arizona College of Nursing in Tucson, Arizona. I've taught at the Middle Tennessee State University in Murfreesboro, Tennessee, which is outside of Nashville. And now I've taught for Grand Canyon University in Phoenix, Arizona. I helped start a associate degree nursing program here in Tucson, Arizona, with an institute, and I have most of my nursing practice has been in the critical care, adult intensive care environment. I've taught pharmacology for many years. Totally enjoy that topic and realize the immensity of it and the impact on those whom we care for, and I guess in some ways the unfortunate emphasis of pharmacotherapy in medicine. But at any rate, I won't get into that, but this will be a great course. I live in Tucson, Arizona, so most of the time Eastern Time is about 3 hours ahead of me. We don't do daylight savings time here. So some of you on the East Coast will be literally doing this class at from 9 to 11 on Thursdays, and others of you out here on the West Coast will be earlier for you, a little bit easier to manage. Let me just say that the first week objectives about asthma and COPD chronic care are to describe the basic physiology of asthma and COPD and describe the classes of medications used in the treatment of asthma and COPD, including delivery systems. There is a link to the NIH guidelines for asthma in the syllabus. That's what I'm reading from right now. And there are some pages to read from. The page numbers don't sync well with the PDF, so make sure you're on the right pages there. And then Katsung, your major textbook, pharmacology textbook, chapter 20. And then for the next week, class 2, we'll be going more into asthma and COPD in terms of acute care. And in that, you'll read a document called the GOLD document, which addresses the standards of care for people with chronic obstructive pulmonary disease. I'll highlight some more of that in class as we go along. Usually the way I work my classes is that the first class we'll just do introductions and get to know each other and go over the syllabus, and then start the lecture. I usually go through the PowerPoint at a fairly rapid pace. Hopefully you've had a chance to take a look at it, and then answer questions along the way. You're free to interrupt me either by posting a comment in the chat or just interrupting me verbally. That's fine, I don't mind. And then once we get through that, then usually we'll have some discussion. Then I do use breakouts. I use breakouts for usually just to go through case studies, have you take notes about the case studies. Then we come back to the main classroom and we discuss each case study and each group's kind of analysis and decisions regarding how they wanted to treat the case study patient. And then we wrap it up from there. And one final thing I want to note here, at least in this introduction, is Class 5 is Exam 1. And you'll notice that that week was the content is coronary artery disease, acute coronary syndrome, and heart failure. So what we'll need to do is we'll need to combine that with week 6 content, arrhythmias and anticoagulation. And the same thing happens in week 9 when you have Exam 2, dermatology. We'll have to take dermatology part 1 content and then link it together in class 10 with dermatology part 2 content. The reason why we've done that is now all of the exams must be done during live session, and I have to be present to proctor, and I think most students would prefer to just combine the content rather than trying to get in a lecture after a difficult exam. So that's how we'll roll, unless the majority, or I would say 100% of our class would like to have some content after the exam on each of those weeks. And just to reiterate too about the policy, you have to make a combined score of 83% in this class, and first you need to make it on all the exams. So your average must be 83% on all of the exams, so meaning that the combined average should be 83. So then after that, then we can pull in some of the other course grades on the assignments as well to help to improve your grade on the final grade. So at this point, that's all I'm going to say. I don't like to do real long presentations in this format, so I'm at about 6 minutes and 10 seconds or so. So I'm sure that I'm forgetting to say some things, but we'll catch up in class here in a week or so. I think we start on the 17th, I believe. Let me look here. I think that's what it is. Real quickly, I'll get my calendar. And yes, first class is September 17th. So I will see you there. That's on Thursday. Okay? Thank you.